Crossover now to Kericho County, where the Ministry of Health has been holding a Universal Health Care Expo and Conference. We're into day 2 now. Our very own Serfin Achieng has been following the conversations there and brings us up to speed now. Serfin, good to see you. What can you tell us now?
Thank you so much, Victoria Rubadiri, back there in studio. Of course, you are right. We are coming to you live from Kericho County. A lot has been happening in this particular county since yesterday. There's been a very big health conference that is happening just a few days before the head of state leads the country in the full rollout of the universal health coverage, an event that will be happening on Friday during the Mashujaa Day celebrations. On day 2, Victoria, the focus has been on the need for digitalization of health records, just to ease and work when it comes to access to healthcare. And we've seen stakeholders led by the Cabinet Secretary for the Ministry of Health talk about how lack of real-time data has hindered decision-making and coming up with policies that would effectively address some of the challenges that bedevil the health sector. And they were just discussing how technology can come in handy to integrate this information from the local level all the way to the health facilities to be able to assist even at the Ministry of Health in terms of how they can be able to come up with workable solutions for some of the issues that bedevil the health sector, and also to help in diagnosis and treatment of different diseases. And as you can see where I'm standing at, it is a conference that is happening just next to where we are. And this particular place right now is where the exhibition is happening. So 2 things are happening concurrently, the conference and the exhibitions, where stakeholders from various departments of the health sector are showcasing what they can be able to offer us when it comes to addressing some of the challenges in the health sector. And just to speak to one of the innovators that are with us in this particular forum, students from the KMTC, one of the issues that was being discussed today is the digitalization of health records. Just for 30 seconds, tell me briefly about how the community health care workers are going to adopt this innovation to ease up information access. I'll hold it for you. Tell me your name and a brief.
Okay, welcome to Kenya Medical Training College. My name is Ronald Achieng. We are here presenting a skill in digital health in relation to community health data collection. So here we are having a digital tool which can be used by community health promoters to collect data out in the field. And the digital tool is open source, which means it is available everywhere in the Play Store. Anybody can install it. And the digital tool itself is having, you can see it here. This is the logo for the digital tool. This is the logo for the digital tool.
Okay.
So from there, you can, the tool provides security. The cyber security is there. And there is also privacy for the respondent.
All right. So does it have like a platform where you will be keying in information from the residents and the households? And how does it get to the server or the main center where you're collecting?
Yeah, there is a server for the supervisor, and the questions can be customized on relations to whichever the health needs of the community. So from there, you find that there is privacy for the respondent by the use of skip logic, whereby if the respondent is not willing to answer some questions which are more privacy, you may skip. Yeah.
Thank you so much for your time. So just a brief, Victoria, of how the community health workers are going to be working with this particular gadget that she has shown us. It's actually an app that has just been installed in a phone, and they'll be going with this particular gadget to different households, and they will be addressing different issues from latrine, from cleanliness, from malaria, diseases, and all that. So it will depend on what information they are seeking at that particular time. They key that in the gadget, and then that information is then transmitted to a central place where now that can give a picture of how the community looks like in as far as that particular health issue that they're addressing is concerned. But we have a lot that has been displayed here, from equipment, from those who are just offering services, from some who are actually just inventing new medicine, and people who are also offering services in terms of equipping the human resource for health. This is actually the area where the exhibition is taking place, but the conference is happening on the other side. It was day 2. The major focus was on digitalization of health information. Tomorrow we are expecting a conversation on health financing and bridging the gap when it comes to making health affordable to all Kenyans. So it's also something that we will be keen on following up for you. But for now, I'll just hand it over back to you, Victoria, in studio.